Well, and joining us now is Africa 54 health correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. Well, the Ebola outbreak in Liberia led to the collapse of most health services, including routine immunization. The country experienced last year what observers called the worst measles outbreak in years. I sat down with Dr. Francis Kateh, Deputy Minister of Health Services and Chief Medical Officer of Liberia. He elaborates on the impact of the Ebola outbreak on the country's immunization process and some strategies in addressing the vaccination challenge while battling Ebola.
There were a lot of things that happened. One was that there was a disease that everyone was afraid of. But I think the key thing here is that you had people with a lot of misconception about how this disease has been transmitted. And with that, vaccination was basically the last thing to talk about, because people were afraid, that if a kid or someone would have been vaccinated, they may be transmitting another virus into the person and so forth. So basically, the expectation or the willingness of a lot of people was at a bare minimum. I would say less than 10% people were wanting to send their child for vaccination.
Before the outbreak, can you give us a sense of where the country was in terms of vaccination?
Prior to the outbreak, Liberia had played a major role. One of the things is that Liberia was declared polio-free. Liberia also, in terms of the various vaccines for children and so forth, Liberia was at almost 85 to 90% in terms of coverage and so forth. So Liberia was doing very well.
When you were confronted with this outbreak and you had to vaccinate children, what was the strategy to be successful?
To be successful is using what we learn in terms of containing Ebola. One of the things that we didn't do right was that we began first using military strategy to fight a public health crisis. And that was something lessons learned in Zaire and other places where you had Ebola. Militaries were involved to quarantine a particular area, and then you go in and isolate people and so forth. So we deployed that in Liberia, and we had a very difficult situation in an area called West Point, where military were involved in gun, and someone died from that. So based on that, we quickly learned that you cannot use that strategy. You have to use community engagement. So we began to work with the communities, educate them, get them involved. And the thing is that community engagement also based on trust. So you have to be as trustworthy as possible and tell people exactly what it is. And so when that trust was built, we used that process to now tackle the measles outbreak when it erupted during the time of Ebola.
You mentioned trust, which was definitely something that was critical, because in the beginning of the outbreak, and this is not just true for Liberia, even in Guinea, Sierra Leone, it seems like communities did not trust the government, did not trust the reports, and they didn't believe that either the disease was real or the transmission. So how was the government, the health ministry, able to build that trust to work with the community?
Yeah, I think there were a few things that have helped Liberia. First, it took leadership. The president of the country was involved at every step. She was also in the field. Another thing that happened is that, and sometimes trust comes about maybe based on some difficult situation. For example, if you were informed that you get this disease by touching someone that is ill, and you didn't believe it, but then you saw someone in your house touching someone who was ill, and that person got ill and so forth, definitely you will say, okay, I think they were right. Also, in every community, there is someone in that community who is trusted by the community. So what we did was using those kind of people in various communities, bringing them out, educating them, and this served as path open up for us to enter the community. You know, you had a consistent message that was clear and that was to the point. And based on that, definitely people begin to build that trust.
And next time, we'll have part 2 of our discussion with Dr. Francis Kateh, Deputy Minister of Health Services and Chief Medical Officer of Liberia, as he discusses a strengthening health system and the way forward after the Ebola outbreak. And that's our Africa Health Report for today.